And you're looking live at a picture of the 8 on Your Side phone center. We have teamed up tonight with the American Heart Association for a stroke alert hotline. You can call the number on your screen right now and get a free cookbook. May is Stroke Awareness Month. A stroke occurs every 40 seconds in the United States. They can be debilitating, even deadly. The key is to act fast. Gayle Guyardo joins us now to tell us how to do that. That's the word, right, Gayle? Fast.
That is the word. Yes, fast, Stacy, is the word. It's part of a new awareness campaign that's spreading nationwide and teaching people how to spot the signs of stroke. Stroke awareness is all about education and learning the signs to look for. With one Bay Area man's case, it actually saved his mother's life.
When I was 6, my mom had a stroke.
Fast on the courts and on the front lines of the FAST campaign. NBA All-Star Paul George is out with a national campaign to teach people how to spot a stroke fast.
F-A-S-T, fast.
These are snapshots of grassroots campaigns, citizens and corporations also spreading the word about FAST. For a Tampa Verizon worker, this lesson saved his mother's life.
But I saw some signs related to what I had learned.
While on a video call, Victor Diaz noticed several fast stroke signs. F, facial weakness or numbness. A, arm weakness. S for slurred speech or difficulty understanding speech. And T is for time. He got his parents to call 911 fast. Just by the sight of your mom walking in the background, you weren't even really talking to her, right?
I was actually video calling my father, and in the background she came in walking, but she was walking very slowly. So I asked them to put her on the phone just to check how she was doing. And when she came on, I noticed that her eye was sort of wandering around, and it was very hard for her to speak.
Tampa General Hospital and USF Dr. Waldo Guerrero urges that acting fast is critical for someone having a stroke.
First starts with time, so the quicker you get to the hospital, the quicker you get the TPA medication, the quicker we can break up the clot and sort of stop the stroke and evolution.
It was that fast action that probably saved Victor Diaz's mom, and he hopes his story will help others.
Well, I want to make sure that people strive to become stroke heroes.
Gayle Guyardo, News Channel 8. And Stacy, what's so interesting is Diaz, the man that works for Verizon in my story, he literally was at that FAST campaign educational seminar just a couple of days before he spotted his mom in the back of that video conference call. So it literally saved her life, just that awareness.
And you're raising it right now. I was actually there at a breakfast when my dad suffered a stroke. We acted very quickly. It was very unnerving and difficult, but he is fine. He's a survivor today. So great story, great tips, Gayle. I appreciate it.
Thanks, Stacy.
All right. And don't forget, our phone lines are open until 6:30 tonight. Call in for a free Empowered to End Stroke cookbook. And a stroke occurs every 40 seconds in the United States. But there are ways to stop a stroke in its path. And Gayle Guyardo is in our 8 on Your Side phone bank to tell us how. Hi, Gayle. Hopefully Gayle is there. There she is. Hi, Gayle.
Okay, we are here with the live phone bank where we're talking about stroke awareness, and it is critical. We have volunteers from Tampa General Hospital actually taking people's phone calls as we speak, and folks have a lot of information that they want to know, and we're also giving out free cookbooks, which is critical. And in just a moment, I'm going to talk to you about why it's so important to live a healthy lifestyle to prevent a stroke in the first place. But awareness is key, and I'm here with Dr. David Rose, and Tampa General Hospital has a very comprehensive center that really is far-reaching here in the Bay Area.
Yeah, it's terrific. We cover a 12-county area, and we deal with very complex neurologic cases that folks send us. Their most interesting and complicated neurologic illnesses like stroke, and we try to address at our university level at Tampa General in a comprehensive way how to treat these folks, because it really is a difficult disease, and a lot of folks don't realize what the symptoms and signs of stroke are, and a lot of folks don't know how to treat it, even in 2015.
But I love the way that you guys are teaming up to make it easy to spot with a simple word, FAST.
That's right, FAST, F-A-S-T. It's a fun mnemonic that we tell all of our patients and their caregivers and families and everybody that stands for this. F is for face, so you ask a person to smile. And if they smile normal, then it's okay, but if it's crooked, then that may be a sign of stroke. A is for arm. You ask someone to raise their arms up, and if one arm starts to drift, if they ask them to hold a pizza box and they're unable to do that, then that could be a sign of a stroke. S is for speech, like slurred speech, can't get the words out, can't understand. And then T means time, which is critical. You gotta get your tail to the ER immediately if you have any of these symptoms.
Because the faster that you can treat a stroke, the faster that maybe you can't reverse it, but you can manage it and get people on the road to the recovery that much faster.
That's right. There is a medication that we can give in the ER to help with reducing the stroke symptoms, potentially reversing it, but giving the patient a chance to have a better lifestyle, to not wind up with, in many cases, permanent neurologic damage, unable to move half their body, unable to speak for the rest of their lives. That can be very unfortunate.
Yeah, it really can. In my personal case, my grandmother years ago, we didn't have this education, so her outcome wasn't so great, but I've talked to other people where they did catch it in time and it did make a difference. And I also know that healthy lifestyle, exercise, that's critical in all of this as well. That's why we are here answering your questions, giving you the free cookbook. So make sure to call into the phone bank. We are live now. Back to you, Stacey.
All right, great information. Thanks, Gayle.
May is Stroke Awareness Month. A stroke occurs every 40 seconds in the United States. They can be debilitating or even deadly. And that's why tonight we're hosting our 8 on Your Side Stroke Alert Phone Bank. Just call 1-800-528-0808 to receive information on preventing a stroke, as well as a free cookbook. The phone lines are open until 6:30 tonight.
You betcha.
And you do still have time to call our 8 on Your Side Stroke Alert Phone Bank. The number is 1-800-528-0808. There you see folks ready to answer your calls. You can also get information on preventing a stroke as well as a free cookbook. Our phone lines are open for 10 more minutes until 6:30.
Had a chance to meet those people. Lovely folks.
They came
folks.
through the studio
Yeah.
from TGH. We really appreciate their volunteering.